Today we'll talk about something related to the renal arteries, and not necessarily that the renal arteries become big or small. It's the vessel which causes a lot of systemic problems, and I'm sure everybody has encountered some kind of hypertension either in their family or some of their relatives, and especially when the blood pressure is not under control. There's a lot of talk about how to control blood pressure medically, but the newer imaging techniques and the newer interventional techniques are such that right now we can treat almost all kinds of hypertension. Why it is not possible? So I will talk about the clinical consequences of renal hypertension, that is any hypertension because of renal artery stenosis. Okay, we are not going to talk about renal artery aneurysms. We are just going to talk about renal hypertension or renovascular cause of hypertension. Now, most of these patients that you see in clinical practice are renal artery stenosis because of atherosclerosis. Okay, and this atherosclerosis is most of the times in the older age group, though the younger population is also now getting early atherosclerotic changes in their blood vessels, especially the coronaries, the carotids and the renal arteries. Okay, why renal artery forms the major cause of cardiovascular events? Because any kind of renal hypertension because of renal artery stenosis is likely to trigger cardiovascular events, and the most important health of an individual depends on the cardiovascular status of an individual. When I say cardiovascular events, I mean only three things. One is either TIA or CVA, or acute myocardial infarction, or gangrene. One of these three major cardiovascular events is going to cause a lot of morbidity and mortality in the entire population. So all these patients with renal artery stenosis will present with, most of them, renovascular hypertension, and half of them will present with acute myocardial infarct or some kind of angina. Some of these patients will also have left ventricular hypertrophy because of long-standing uncontrolled hypertension. You might have seen a lot of aortic dissections on CT scan as a consequence of renovascular hypertension, and most of these patients untreated will eventually lead into end-stage renal disease or chronic renal insufficiency.